Recording in progress.
Okay, right. So let us start with today's topic, that is tumor markers. Okay. So once we have to understand the tumor markers, so these are some molecules which are secreted by some cancer cells in the blood. And basically, more than diagnosis, they help in follow-up of the patient. Okay. So because these are some markers which are secreted from the tumor cells in the blood. So therefore, it basically helps in monitoring the patient. So most important diagnosis of tumor marker is in prognostication and monitoring. So very rarely they can also help in diagnosis, but the most important function is monitoring. And high tumor markers, some tumor markers whose levels are very high, they can also help in prognosis. But the most important function of this tumor markers is monitoring of the cancers. That is very, very important. Okay. Now, once we are clear with this, or this is a table from Robbins, which gives you a big table in which how and what all tumor markers are there. So we'll come to that later. Let's start with the first one. The first tumor marker which we always have is a carbohydrate antigen, and that is why it is called CA. It's a carbohydrate antigen. And when we talk about CA, so we have certain carbohydrate antigens which are very important. The first one being CA125. CA125 is positive in all these surface ovarian tumors. So any surface ovarian tumor, when it is there, it is CA125 positive. Okay. Now, coming to the next one, you should remember here, whenever we are talking about this, CA19. Okay. So C9 is like ulta of P. So this is seen in pancreatic cancer. So this is seen in pancreatic cancer. So pancreatic cancers are positive for CA19, and that is what you have to be very, very clear. Okay. The next important carbohydrate antigen is CA15-3. Okay. So remember, CA15-3 is very, very important in primary breast cancer. So whenever we have a primary breast cancer, that is positive for CA15-3. But whenever they change the question to metastatic breast cancer, so if you have to detect a metastatic breast cancer, then your answer will be 2729. This is the marker for metastatic breast cancer. Okay, so remember 15-3 is for primary breast cancer and metastatic is 2729. Okay, now there are some hormones which also act as a tumor marker. In this, you have to remember first beta HCG, which is very common in trophoblastic tumors like choriocarcinoma or testicular choriocarcinomas. Okay, so they are positive for HCGs. Okay, now remember, sometimes testicular seminomas can also show you HCG positivity. So that is another point that you have to be very clear. Now, calcitonin is another hormone which is very positive in medullary carcinomas of thyroid. Okay. So medullary carcinomas of thyroid produce amyloid and they are calcitonin positive. ERPRs are positive in breast cancer and thyroglobulins are very important in well-differentiated thyroid cancers. Okay. So apart from that, there are two hormones which are very, very important that they ask you again and again. One is VMA, that is vinyl mandelic acid. This is very positive in neuroblastoma and it is detected in urine. So 24-hour urine samples are used for it. Whereas metanephrines are basically MP. Okay, so metanephrines itself is MP. It's positive in pheochromocytoma and you have to detect them in plasma. Now, coming to the oncofetal antigens. So here you have to remember oncofetal antigens are those which are either present in the onco or in the fetal life. Either they're present in the fetal life or they're present in the cancer. So that is very, very important. So here we have two tumor markers which you have to remember, alpha fetoprotein and CEA. So alpha fetoprotein are very, very important in presence of hepatocellular carcinoma. Apart from that, they are also positive in hepatoblastomas, and they are also positive in yolk sac tumors of ovary and testis. Okay, so these are the common tumors where alpha fetoproteins are positive. What about CEA? CEA is positive in colon cancer. So CEA is positive in colon cancers, and that is what you have to remember. Apart from that, this can also be positive in lung cancers. It can also be positive in some breast cancers, okay, and some pancreatic cancer. So it's not specific only for colon cancer. It can be positive in lung, breast, and pancreatic cancer also, okay. Sometimes it is also positive in gastric cancers. So this is CEA, which is non-specific, and it is positive in, this is carcinoembryonic antigen. Name itself says carcino means cancer, embryonic means fetal life. Carcinoembryonic antigen, positive in colon cancer. So that is why monitoring becomes very important rather than diagnosis. You have to use it for monitoring of the cancer. So today the level is 100, tomorrow it becomes 2000. That means the cancer is progressive. Okay. Now, the new tumor markers which came into attention were some of the tumor markers which came into attention were CIFRA. So CIFRA 21 is nothing but it is a soluble fragment of CK19, and it is basically CK is a marker for squamous cell carcinoma of the lung. So these are positive in squamous cell carcinoma of the lung, and it's a new tumor marker, and that is why you have to remember the CIFRA 21. Apart from that, you have to remember one more point here. So if you look at this, so remember there are some lineage specific proteins. Okay, so there are some lineage specific proteins which you should be clear. And in this we have immunoglobulins which are seen in multiple myeloma, or we have prostate specific antigens which are seen in prostate cancer. So they are lineage specific proteins which you should be clear. And another set of new markers that have come into attention are now called as cell-free DNA markers. So they are cell-free DNA markers like EGFR. So EGFR positive in lung cancer. Suppose if you detect APC, KRAS and P53 in the stool, that is positive in colon cancer. Similarly, if you detect P53 and RAS in the stool, then it can also be seen in pancreatic cancer. If you see it in sputum, then it is positive for lung cancer. If you see it in urine, P53, then it is positive for bladder cancer. So the source becomes very, very important. So especially APC, if it is coming positive in the stool, it is colon. And RAS, if it is coming positive in the stool and serum, it is pancreatic. In the sputum, it is lung. And the urine, it is bladder. So these are the important points that you have to be very, very clear. Okay. So these are some tumor markers which you have to be super clear with. Okay. Now, once you're clear with this, let's look at this question here. So this is a 65-year-old man with weight loss and has a history of long smoking. Now he's found to have a lung mass. His serum shows CEA levels which were very elevated. So this is just to tell you that CEA is not only positive in colon, it can be positive in lung, breast and pancreatic cancers also. Okay. So what is the most appropriate way to use CEA in the patient's care? So remember, CEA is non-specific and basically it is used to follow up the patient, to monitor the patient and to identify if there is recurrence, how the patient is responding to therapy. So monitoring is the most important key here. Okay. So that is about tumor markers, which everybody should be clear. And that's all, guys. So that is tumor markers, which you should know, right?